All right, welcome everyone. Great to be here. Pretty excited about today. Today is our first in a series from the Public Health and Policy Conference live series. And you're in luck, guys. I'll be your host for this wonderful, as Jess is laughing at me, or with me, we'll say. It's going to be exciting, guys, because we are here. We're going to be here live for the next 6 months. We'll be doing this every 2 weeks. Thank you so much for tuning in. Thank you, everyone from obviously CMV Canada, Kayla and the wonderful people there from Merck. Thank you for your support for this. National CMV Foundation, thank you guys. Always, we're so thrilled to have you guys as partners. And obviously NCHAM, Allison and the wonderful people at the university, I want to say it's Utah, right? Yes, Utah, as Jess is nodding. We're thrilled to be here and we're excited. So there's been a lot of really fun development in the CMV space today. On our show, we have Jessica Dunn. So she is no stranger to all of you who are aware of what's happening with the Public Health and Policy Conference because she was co-chair of the Ottawa 2020 conference. That didn't happen. Happened virtually, which was a huge hit. We'll talk about that a little bit later on. But she'll be chair of next year's Ottawa 2021 conference. Welcome to the live, Jessica.
Thanks so much, Rob. I'm really pumped to be here.
All right, I'm going to call you Jess, if that's okay.
That's my name, yep.
All right, perfect. So let's maybe start with the kind of the history of Ottawa 2020, if you don't mind, how that whole thing came together. Because I was co-chair and Dr. Soren Gant was co-chair of that as well, but you really put that together and you really did a big chunk of the work to get that to Ottawa. First time outside of Canada. Maybe tell us a story about that.
Yeah, I think I have to just say the first time I attended the CMV Public Health and Policy Conference was in Vermont, and I was pretty impressed by it because it's different than a lot of the conferences that I think we go to, most of physicians go to or researchers go to, and it really was great to bring together both families and researchers and clinicians from all aspects. That made it a bit of a different feel. And I just thought how impactful and important it was to have all the stakeholders at one meeting to make a change about CMV. As you know, Rob, and I think a few other people know, Ontario has started last year in July a option to screen for universal screening for risk factors for hearing, of course, one of the most important ones being CMV. And as we attended this conference last year and kind of leading up to it, I thought, wouldn't it be a great opportunity to bring CMV interested folks to Ottawa to hear about what was going on in Ontario. And I think there's been so much positive outcome that's happened from that conference over the years, and it's really kind of moved the landscape for CMV advocacy across the states. I thought there was a lot that Canadian parents and families could learn from it, and there was a lot that we could kind of share, both what had gone well and some challenges that are coming up from the universal screening offer that's happened in Ontario. So just started drumming around.
Ottawa? Why Ottawa?
Well, Ohio, Ottawa. It is where the Newborn Screening Ontario is housed at the Children's Hospital of Eastern Ontario. So that's number one. It just is a focal point for CMV testing right now. And as you know, it's the first place. A lot of people are interested in doing CMV screening on a population level, but it's the first place in the world that has started offering that. So it's great there. Ottawa's my hometown, so I'm very attached to it. It's a wonderful center to visit, tons of museum, lots of cultural stuff. It's beautiful in the summertime. And it's pretty accessible to many places from the US, big airports. So I think we just thought it would be a great chance to come together. And as I was thinking about it, who better from the Canadian world of CMV to kind of bring it together, but you as the head of CMV Canada, and then Soren as well. And we just thought it'd be a great opportunity to try and host it. I think we weren't sure if that was going to be an option. So I contacted the the directors or the organizers, Allison Ward, ahead of time to see would they accept an application or would they consider an application from a Canadian city, and certainly they were open to it, and we put in our bid, and I think we made a good case for it. So really looking forward to next year. Disappointed about this year, but looking forward to next year.
Yeah, I mean, COVID wasn't your fault, Jess, so don't.
Thank you. Thank you. It relieves a lot of guilt to hear that from you.
Yes. It was really neat to meet you. I think I met you in Burlington the first time, and some of the other Canadian. I'd been going to these things for a while. I think they're unbelievable. I don't think I've ever missed one. And then we saw each other again in Birmingham, I think, for the global conference, and really a lot of positive momentum happening in Canada. So you mentioned Ottawa. It's great in the summer. You mentioned it's also, for anyone who's watching global here, it's our Canadian capital, if that matters. It's the capital of our country. And Canada is such a small country that for me, being in Winnipeg, Manitoba, it's only a 24 or 23-hour drive to Ottawa. That was sarcasm. It's a long ways away because we're a big country, and that's the neighboring. But it's actually really close to the U.S. It's really close to New York. It's really close to all the eastern counties and all the eastern time zones. So I think it's a great idea. Plus, it's such a beautiful city. So many neat things to do. I am so looking forward to it. I think next year is going to be unbelievable. I was really hoping it would happen anyways, but obviously we couldn't have it. So you talked a bit about the story behind Ontario screening program. So I know Pranesh talked about, maybe I should pause real quick and remind everyone that I'm Rob Tatro from the Canadian CMV Canada and the Canadian CMV Foundation. President and founder of the Canadian CMV Foundation. There's been, and I'm here with Dr. Jessica Dunn, Jess Dunn. She's a Pediatric Infectious Disease Specialist, originally from Ontario, as she mentioned there, now working out of Alberta. Jess, so for anyone who's watching here, maybe talk a bit about the universal screening, how long it's been, just kind of a bit of a background about that, which started, when did it start, kind of some bigger picture items.
For sure. And I think it's really important to understand that when Ontario was thinking about considering, wasn't CMV specifically, but I think they recognized that universal hearing screening that's done across the US and across Canada, right now it does have its certain limitations. And they do at birth physiologic screens. That basically means putting in little probes like you and I have for our earphones right now, and to test hearing at birth for infants. It's not perfect. It does pick up a lot of children, but what it is a bit weak or vulnerable to is that it can't pick up children who are at risk for hearing loss later on. And that's something that we know with CMV, that there are a certain proportion of children who have completely normal hearing at birth, and who can later on go to develop a hearing loss, and they might fall through the cracks and not get recognized till later. And there's a lot of evidence out there to show that any intervention early on to intervene upon hearing and improve hearing improves kids' outcomes, not only for their hearing, their language, but for their overall development. And these changes last throughout school and adulthood as well, in terms of how they do and affects their lives long term. So the screening program in Ontario had recognized that there were a few well-documented causes, genetic causes, as well as the big environmental cause being CMV, that were risk factors for this. And so the idea came about, been proposed before, could we test for these risk factors and offer better hearing screening to these children that are at risk, and hopefully improve their outcomes. And that's where the idea was born long time ago. It's been a long process. It's been put in the works, a lot of work to get the testing done, a lot of work to get the program set up. And it launched in a way to test what we call targeted screening in May of 2018. And that was just all children that did not pass their initial hearing screening were offered this test. And then last year, in May of 2019, so just over a year ago, we started offering universal screening across the province of Ontario for both genetic risk factors and, what's really relevant here for this chat, for CMV testing. And so far,
first place that I know of on the planet, right? That's doing so.
Yeah, it is the first place, and so no roadmap to do this yet. When you're the first place to try something, but there is a lot of investment and support from the community to keep trying to figure out how to do this. And I have to say, although this was designed to be an enhancement and to sort of support the hearing screening program and hearing outcomes, we all are also identifying children with CMV who may not have necessarily hearing outcomes, but do have other consequences from their CMV infection. And to date, in the first 12 months of the program, we have picked up 182 children from that screening program from the dried blood spot. So I don't know if most people know what it is it's all children at birth will get a little heel poke and they get a little drop of blood that gets tested for multiple different diseases that, could be anything from an endocrine or a hormone problem or a metabolic problem that might not get picked up. And we're able to test for these risk factors on the dry blood spot. And so now we've been found about 182 kids from CMV alone that might not have otherwise gotten picked up.
That's unbelievable. So First off, pause and let's acknowledge how unbelievable that is. There are 182 kids that now have a diagnosis, that now some of them have been treated. Some of them, at least the parents are aware, they're watching for signs of whatever it may be. There's just going to be a positive outcome, a much more positive outcome for a whole bunch of reasons that we don't have to get into now. But you can imagine, as a parent and as founder of Canadian CMV Foundation, I'm getting a little emotional here because this is a huge win. This is a huge, huge, huge win for us. And I'm so thankful to you, to Dr. Pranesh Chakravorty, to Jason Brophy, to Marie Pigeon, to the entire team, all of you guys for putting this together and executing. It's unbelievable. You're a model for what we should be doing in every single province in the country. Maybe we can improve the different ways to do it, whatever. We're there, we're on the bleeding edge, and you guys are doing it. And to all the viewers that are watching in the US, I hope that this is inspirational to you guys as well, because the National CMV Foundation, they've done a ton of phenomenal work to pass legislation for all sorts of things in the US and many, many different states. So I hope that this is further inspiration, as it is to me, because it certainly is to me. So congrats. It's unbelievable. I'm so proud to know you guys. I'm so proud to be a part of this. So you're helping outcomes for families.
Well, I'm just going to take that and mirror back, because I think, Rob, I've said this to you one-on-one, and I think it's important to kind of acknowledge in a public forum that I think you've been the catalyst for a lot of movement about CMV advocacy across the Canadian landscape. And I know that for us, having you involved in sort of the impact of what screening has done and the work that you've done to kind of bring more families together is it's huge. And that's really what I think most of us are wanting to make a difference for. As well, I think it's also what kind of that combined interest and passion is really what the conference is all about as well.
It's going to be so fun. Thank you for that, Jess. But it's parents across the country, from Lisa, and there's so many different parents across the country in Canada that have kept working. Lindsay as well, and in Ontario we have a bunch of parents now. We got parental advisory committees in the provinces. There's been a lot of progress in Canada, and I am thrilled to say that the parents have a much louder voice, and that's one of the outcomes that we wanted. Because what's neat is that parents and healthcare practitioners working together to save babies' lives, to me, is the coolest thing, because there's no way we could have done this on our own, and we're proud to be a small part of what you guys have done. So anyways, all in all, great work. Ottawa 2021. So let's go back to the Ottawa 2020 conference, which didn't happen. We had a virtual series. So that was really neat, Doctor. We had 5 different presentations. Did you catch any of them? I mean, you were probably biased in which one was your favorite one, because I know your former colleague, Dr. Chakravorty, did speak on the Friday. That was a really, really neat topic, because he gave us an update on the universal. Dr. Gail Demler presented on the Monday, if I'm not mistaken. And there were some very good ones. Did you catch it? And for those of you that didn't, you know you can go to the website, the NCHAM website, and you know you can catch them. They've been recorded. The links are there. Really, really interesting stuff. Which one was your favorite?
I don't know. I mean, the great thing about that, and as you know, when we were kind of deciding on the planning committee about the different speakers to have come forth in this virtual conference, I think they all brought a bit of a different, area to it. So I think it's hard to pick which one was my favorite. I one that I wasn't able to attend, but I was able to get to. I think about 4 of them from the other ones. And you're right, I'm a little bit biased, but I knew everything from the Ontario story. So if I can say, for me, I mean, the part that kind of gets me the most, excited, or that I like that we had the parent stories at the beginning of each chat. And I just think that kind of, again, brings it back to what we're trying to do and the impact that we're trying to make. But they were all great. Albert Park gave a great talk. Gail Drummond always does as well. So can't pick. It's like picking your kids. Can't
fair enough. We did have a bit of so there's a reference to a sports reference, but we did have a bit of a murderer's row here, the 1929 Yankees of presenters during the week. It was like Ruth and Gehrig and whoever else was there. So we had the who's who and some really, really good names presenting. So it was neat. If you haven't checked it out yet, go to the website, check it out. I should also say before, I should have done this earlier. If you're watching on YouTube, please take a sec to subscribe to our channel, the CMV channel. If you're watching on Facebook, please take a second, follow our page. If you have any comments, we'd love to hear them. And by all means, please subscribe to our newsletter, the CMV Canada newsletter. It's a once a month newsletter. Stay on top of what's happening. Go to our website, CMV Canada, for that. So we talked about the universal screening that you were a part of. So what do you kind of see? I'm going to ask you just kind of some, generally, what do you see happening kind of, I guess, now that we're, what are we, 9 months into COVID, 6 months into COVID? Hopefully we're still having our Ottawa 2021 conference. It's going to happen. Mark my word, guys. It's going to happen. Well, you shouldn't mark my word, but hopefully it happens. If not, it'll happen virtually. What have you seen that's changed in anything? Now you're no longer in Ontario, but you are in Alberta, and you've seen a lot of the impacts of COVID. Very briefly, have you seen anything kind of that's changed on that front?
I think everything's changing, or we're getting a better understanding of COVID all the time. And yes, I'm in Alberta now, but I was in Ottawa when COVID kind of first made land in Canada. It's impacting everywhere. I think we're slowly adapting to what is going to be the current normal that will be for a while, for sure. I think people are having a bit more. There was a lot of uncertainty and panic at the beginning as to what this would mean and how it would affect people's lives. Certainly, as you can speak better to, the economic implications as well, were giving people a lot of concern. But I think now we're just trying to, but I think now we're really just trying to figure out, this is here, it's probably going to be here for a while, and how do we kind of return in a safe way to normal activities? So children are going back to school now, which is great. Some activities have opened again, in terms of like restaurants and stores and whatnot. So I think we're just figuring out how to adapt to this new way in a safe practices. And, I'm optimistic about Ottawa 2021. And, we are in a very different place than we were, 5-6 months ago with COVID. And so we'll see where we are next summer. I know that the conference organizers and the directors have nothing but people's safety at the forefront. And so we're just going to kind of proceed and adjust as needed, like we did this year.
Okay, so on the universal screening front, those of you that have followed the CMV Checkup, our live show that we do about once a month on the CMV Canada homepage and the CMV Canada YouTube page, I've spoken at length in the past about why I think universal screening is critical and important. You've touched on it a little bit earlier, so I think it's critical to diagnose parent anxiety, getting that diagnosis early, follow up, early hearing intervention, being able to treat. If we have a child that's, my son was treated, with valganciclovir years ago. Would it have been ganciclovir or valganciclovir? It would have been
Probably
ganciclovir. Yeah, because it was through the PICC line. So we know we can treat. We know we can have better outcomes through treating. What's your take on universal screening on the healthcare practitioner side?
Yeah, I mean, I think certainly I think that the screening that we've done is made, it's had a few direct benefits in terms of identifying those families, giving them a diagnosis for something that might not have otherwise been made obvious. I think one of the secondary benefits that we've had is that we've really increased awareness among healthcare practitioners in terms of looking out for this. So even in a situation when screening is not perfect to pick up every single child, it's raised awareness, and I think people are more in tune to it. I think it's also encouraging women, parents, just who are expecting to have conversations with their prenatal care providers as knowledge is increasing about CMV. So I think those are a ton of the benefits. I think from a healthcare perspective, we're still learning more. So far, I would say most of the parents that I have seen in clinic are similar to you in that they are grateful to have the information. What is more complex about CMV is, as you know, only about 10 to 15% of children have obvious symptoms at birth and may then be eligible or require treatment with medication. There's a number of the rest of those children may not necessarily develop symptoms. And so there is a question is, are we, introducing some uncertainty to parents and some anxiety that could be in there? But we're looking to understand that better as we're going forward with this screen. And I think a lot of parents so far are just grateful for information and the ability to know that their children will be followed closely.
My opinion is biased because I'm a parent, but I believe strongly, and I spoke up in Birmingham and I spoke up in Burlington, and I said this to the entire room. We as parents deserve to know, and we have the right to know. So that's my opinion, and I do believe I am speaking for parents when I say that. Happy to get your hate emails if you disagree. Please do send them to me, rob@cmvcanada.com. Let's take a look at the upcoming, and by the way, very well spoken there. I'm excited about this live series, the CMV Public Health and Policy Conference live series, every 2 weeks for 6 months, right here on the CMV Canada YouTube channel, on the CMV Canada Facebook channel. In 2 weeks, we got the National CMV Foundation. So they're going to talk about spreading CMV awareness, how to get involved in your community. 2 weeks after that, I think we have the group from Australia confirmed. We have CMV in pregnancy going to be covered. We have the Florida CMV collaborative approach. That's going to be in November. Really, really neat stuff on use of saliva samples for newborns. We got engaging children early in active learning at an early age. So we got speakers from all over the US. We got speakers from Canada. We got speakers from Australia. This is going to be a really, really neat series. The speakers are booked. We're going to have about 12 seances, if that's the right word, over the next 6 months or so. Please do not miss out. Tune in right here. Do want to give a shout out to CMV Canada, to Merck for generously supporting us here, National CMV Foundation, and to NCHEM. They're wonderful, wonderful. Allison and her entire team. Mandy, you guys are awesome. So fun to work with, so easy to work with. So thank you, everyone, for taking the time today. Thank you to Jess for sharing your insight on the experience in Ontario. You are a great first guest because you are the chair and I should say the co-chair of Ottawa 2021. So thank you for being here.
Thanks for having me, Rob. And just to pump your tires a bit more, I think that you've really lined up a huge, set list, as it were, for the sort of the big players in CMV that are coming to speak, over the next 6 months. So I'm excited to see them as well.
Yeah, and if you miss it live, don't worry about it because you can catch it on YouTube after the fact or on Facebook after the fact. So once again, thank you. Thank you to all the viewers. We will see you guys in 2 weeks with the National CMV Foundation talking about how to get involved in your community and spreading awareness. But throughout the event, it's going to be about half kind of healthcare practitioners, policy, and on the parent side. So looking forward. Thanks so much, guys. Have a great day.